Sharad Jain. Dr. Sharad Jain, he is Master Trainer of Medical Officer, Paramedical Staff and Senior Consultant. And he retired Professor HOD Pathology and Transfusion Medicine, SS Medical College, Jabalpur. He is consultant, Jabalpur Blood Center, consultant Jabalpur Pathology, and he is very brilliant in subject. We will be benefited by this. Over to you, sir.
Very good morning to everybody. I really thank the organizers for calling me for a scientific talk. Respected chairperson and all my colleagues. Since yesterday we are talking of ED and what ED. But what ED is creating problem is a real serious matter now. We have to understand the gravity of what complication our society is developing, our youth, what is they doing, and how to handle that situation is very, very important now. Considering the most important part, there are several diseases which are quite curative, but we just ignore, and all. I come with the talk. I welcome you all, the sex therapists within NACO MP Sex supported one of this scientific talk, Syndromic approach to diagnose, treat RTI, STI and its complication. Really need of the hour. The importance of this topic itself says, globally this is the hottest topic and generating a lot of interest in the era of HIV/AIDS. The basic concern of mine is to create the awareness about the magnitude, how spreaded this condition is, the seriousness and complications of common RTI. If we ignore it and if we left untreated or improperly treat these patients, there is a high risk of 8 to 9-fold rise in the HIV transmission. Simple history taking and good clinical examination, you can able to diagnose almost all type of curable STI, RTI. That is very important. Be a doctor, not as a pathologist report daily, then we'll treat the patient. That is not required right now. And treat the patient using syndromic flow charts. These charts are so scientifically prepared that you can treat the patient on his first visit, all these curable STIs. Understand the RTI and STI meaning any reproductive infection, tract infection, we call it as RTI. But any bacterial, protozoal, viral, any type of infection passes through sex, we call it as STI. The magnitude, you can understand, more than 374 million new cases are of curative STI every year. This is the 2020 records. So in 2024, I expect even much more. Out of which 75 to 85% of the patients of RTI, STI are in the developing countries like us. In Indian scenario, more than 6% prevalence in Indian society population. Every year 35 to 40%, 30 to 35%, 35 million new cases of STI every year we get in India. And here, unfortunate is that we don't have a record keeping properly. And that is why we cannot 100% be sure about, even we can see percentage minimum was more. Secondly, third point very important, above AP examining in the RTI STI clinic, almost 3 times males are attaining, females only 1. Out of 4, 3 male, 1 female. Why? Either male is aware of it, they consider because of the female, their biological organs, they are unable to identify the STI. A list of various communicable diseases are there. I'll take up next slides. So now the question of RTI and STI management includes correctly diagnose and treat the symptomatic RTI STI cases. Secondly, most important point, don't ignore that point, that you have to counsel and educate the patient how and why he developed or she developed this disease and prevent the reinfection part. Steps of syndromic management, you have to devote time for good clinical history taking. By simple history taking and good clinical examination. How many of us examine a patient keeping complete unrest? I don't think anybody. करते हैं आप unrest करके करते हैं with modesty? नहीं करते. Secondly, patient जरा सा open करेगा, दिखाएगा सर मेरे को ये प्रॉब्लम है. Agree? होता है ना? कोई नहीं दिखाना चाहता. Now I want to emphasize you here that oral sex is very common. The abnormal sex are also going on. So you have to address the patient completely in a bright light. You have to examine the other parts also. Oral cavity, anal region, they are very important to understand the STI. Diagnosis, make a diagnosis. Laboratory test, yeah, just definitely must play an important role, but they are additive to your diagnosis. Treatable RTI, STI. Prescribe the standard simple treatment during his first or her first visit. No, never ignore. आप एक काम करिए, ये इन्वेस्टिगेशन करा लाइए, उसके बाद में मैं दवाई लिखूंगा. बहुत समय से यही चलता आ रहा है, and patient may come, not come, or he will go to a medical store, एक गोली खा लेगा, उसको अच्छा लगेगा, and then it becomes a resisting type of disease. So you have to understand that. Advice and counseling and next follow. Syndromic approach has got some pros and cons. Pros, they are n number. You give a quick response to the patient, prompt treatment, highly effective treatment. Majority of diseases are curative and you give effective treatment to that. Relatively inexpensive. These drugs are not very expensive. Scientifically proved, don't take it as a quackery. It's not a quackery. Initially, I thought in terms of it is a, you teach us a quackery. आप इतने बड़े advanced technology बता रहे हैं, पर मुझे तो एक quackery लग रही है. But later on, I realized that this is very scientific. Effective from primary to tertiary care. Yes, you may be in a village where there is no facilities, to a highly tertiary care hospital also. You can give treatment at every level by syndromic approach. Effective to all curative STI during their first visit. Every time, why I am insisting for first visit? First and foremost thing of treating STI is treat at first sight, immediately. Sometimes some cons are also there, not useful in asymptomatic. If you don't have any symptoms or any clinical sign, you cannot treat. Secondly, sometimes it is possible that you are giving over treatment or drug resistance is also a possibility. More inside the RTI STI syndromic flow charts, there are several flow charts I have just described here, but I will go one by one in details about it. Flow charts of male urethral discharge syndrome. It is a syndrome. What are these? What are the causative organisms? Gonorrhea, chlamydia, trichomonas, they are the main source for infection. What is the basic history you come across? Patient will come, history of exposure, you have to get it clear. Discharge and burning in maturation. If you examine thoroughly, you will find a meatus red, swollen with discharge and sometimes pus coming out. Lab diagnosis, if you have that facilities, it is definitely a wonderful way by demonstrating simple gram staining. You can show intracellular gram-negative diplococci. They are nothing but gonococci. Chlamydia, you cannot demonstrate. So, investigation, it is a very important part that you may not be having, the person may not be having single disease. It is a battery of diseases at a single stretch of time. So, you have to go for some investigation at a primitive level to basic level, HIV, hepatitis B and RBR for syphilis. There are some simple treatments, tablet suffixing, 400 milligram, azithromycin 1 gram, single dose therapy, single dose. But if patient is not responding, you can continue for 7 days. Secretazole is actinidazole, like this, 2 grams at a time with antacid and antiemetic. Follow up if possible. There is a possibility of reinfection also or treatment failure. The second most important is scrotal swelling syndrome. In this, scrotum is inflamed and patient comes with a severe agony, with fever and something. The organisms are almost same. History of contact, positive scrotal swelling, burning maturation, malaise, fever. Scrotal swelling, tenderness, edema, red, urethral discharge, you look after. Lab diagnosis is same, investigations are almost same, but you have to make a differential diagnosis here. Differential diagnosis, maybe patient may be having trauma or some inflammatory other conditions like tuberculosis, filariasis, mumps, viral, non-viral inflammatory, hernia, hydrocele, they are very common, or any scrotal tumors. So treatment here, you have to increase the duration of the treatment for almost 7 days or till his condition subsides, along with anti-inflammatory supportive T bandage. Inguinal bubo is one of these syndrome in which the positive organisms are lymphogranuloma, venereum, chancroid, chlamydia. History of positive contact. Here you see in the inguinal region there is a lymph node which having no fluctuations and sometimes you may get discharge. Lab investigations are very tricky. In this, nucleic acid testing, PCR or sometimes culture are recommended, but it is even at a tertiary level hospital you do not have this facility. Investigations are as a routine, but you have to exclude tuberculosis, filaria and malignancy. Here, most importantly, they continue the treatment in the same way, doxycycline for 21 days, azithromycin for even 7 to 10 days. Ciprofloxacin is also effective. No IND is indicated here. नहीं तो यूजुअली हम कभी भी लिम्फेडेनोपैथी है, पैथोलॉजिस्ट के बाद में जरा एफएनएसी करके बताओ यार क्यों ये तो नहीं है. So please, here no IND is required. Partner treatment is important. Genital ulcer syndrome, this is very tricky. In this, there are n number of organisms: treponema, hemophilus, chlamydia, herpes, klebsiella, granulomatous. Here, ulcers or you can get ulcers or blisters, vesicles. And in this, exposure history is always positive. But be careful here. There are some important tools you can understand very well. Painful ulcer or vesicle, this is herpes. But if it is painless ulcer with short lymph node, separated. The third thing, painful ulcer with lymphadenopathy, with lymphogranuloma, venereum, granuloma inguinal. Painful ulcer with chancroids. So lab diagnosis is also very tricky. Investigation are as a routine practice we have to perform. Treatment here, if you consider as a viral, acyclovir is important. 7 days therapy, syphilis, benzathine, penicillin in the syphilitic cases, azithromycin, ciprofloxacin. Continue treatment till it heals. Vaginal discharge, the gynecologist usually will recommend for pap smear, but there are gonorrhea, chlamydia, trichomonas, herpes, candida, and bacterial vaginosis. Here the same picture is there, but you can go for wet smear, trichomonas demonstration, and then KOH for candida. Smear if showing clue cells, Michael. Here in pap smear, if you find clue cell, it is bacterial vaginosis. Investigations are same, but here nowadays we can think of HPV test also. Treatment is same, but you have to treat little bit longer time with fluconazole. One more PID syndrome is there, gonorrhea, and the same picture is there, but patient is having complaining of pain in abdomen. Yes, I finish. Treatment is same. You will like. So treatment is almost same, and you can go ahead with that. But here, if it is not responding, you have to hospitalize the patient and review thoroughly by endoscopy. Yes, so sessions highlight facts and impacts you have to realize about STI, RTI. Scientifically and proven approach flow charts are there. Flow charts, clinical diagnosis, lab tests, supportive, all these things are with you. Primary complete treatment of curative STI during first visit, still first visit, and untreated or missed lead to 8-fold rise in HIV transmission. That is a serious matter to be considered for all the sexologists. So adopt syndromic approach to treat RTI, STI successfully. Thank you very much.
Very nice.
Thank you, Dr. Bhajan, for the elaborate and presentation. And